So a while back, I talked about how you can tell the difference between a care provider who is going to support you versus one that is basically narcissistic and is going to try to control your birth. This is not what we're talking about today. We're not talking about trying to get a care provider who is not a good fit on board. But sometimes our care providers, while they're good on paper, and they seem to be supportive of your alternative birth plans, there may be some times where they're just starting to feel that resistance, that fear. And that comes up a lot of the time because they've just never done it that way before. Oftentimes, the way that they've been taught has been they make the recommendation and the patient accepts the recommendation. And they may have a lot of stress coming down from their colleagues, from the way that their birth culture is within the hospital, within the health authority, and they're really trying to protect themselves. And you just sitting there can cause a lot of fear and tension to come up. So right now, my wonderful friend Jenny is currently pregnant and she wants to go for a vaginal birth after a previous cesarean. Jenny has had a few complications in her past pregnancy. She doesn't have any right now, but because of that, she's been labeled as a high-risk mom. We are also in a health authority where the midwives really don't have a lot of say, so they aren't able to support her. So in the end, Jenny was not able to get a midwife like she wanted. However, she is now with a care provider who seems very open to the idea of her having a vaginal birth after cesarean. However, because of the way that our health authority is, there are also a lot of restrictions on that. Our system is VBAC tolerant, not VBAC supportive. If you want more information on VBAC tolerant versus VBAC supportive, I do have a video inside of the guide section of this Facebook group. And if you're on YouTube, you can go to facebook.com/group/empoweringmomsbirth, and then you can check out those videos as well. You can also go to vbacfacts.com, and Jen Kamel also talks about VBAC tolerant versus VBAC supportive, and I will be doing more videos on this in the future as well. But the basic idea is that in our health authority, you're allowed to try for a VBAC, but the practices that are in place do not support physiological birth. It doesn't facilitate that, and you're more likely to end up in a C-section. Oftentimes what happens is that moms who have tried to have a VBAC and are attempting a VBAC are with VBAC tolerant care providers, or those who may not be up to date on the evidence, or who have policies, or their health authority has policies that basically make it seem like they have no options and that they have to have continuous fetal monitoring, or they need to have vaginal exams in labor. And the fact is that those things are not evidence-based and can actually interfere with a physiological birth. Also remember that when you introduce any interventions into birth, it is no longer a physiological birth. A physiological birth is one that unfolds without any interference. It's your body's own natural rhythm and how your baby and your body are working together, and you're working with your body and your baby to birth your baby. And if you want to learn more about physiological birth and the dance of childbirth, Reclaiming Childbirth as a Rite of Passage is one of my absolute favorite books on this subject. In fact, Rachel Reed goes into a whole story using a character of Eve to basically explain how the birth process works at all different stages. It's an absolutely fantastic book, but I don't have time to get into that today. Today, I'm going to specifically focus on what I've been doing working with Jenny and with my other clients when we have come up against resistance with a care provider. So before you even hire your care provider, before you even go into those appointments, you first need to be very clear on your birth vision. Your birth vision, of course, as I've talked about, is your birth plan, but it's more than that. It's also a pregnancy plan. It's how you want to feel in your birth during and after. It's how you want to basically work with your body. If you have things that are really important to you, such as how you want people to communicate certain things. Whereas oftentimes with a birth plan, you say no medication, but then your nurse will offer you medication. If you have in your birth vision how you want them to communicate that they have the medication available, or if you don't, and you would rather they use a password and wait for you to use the password yourself, as I did in my birth with my son. And I said, don't offer me medication, don't even mention it. If I want it, I will say the password and I will get what I want. That's how I got my gas, and that is how I avoided an epidural, is I had that password in place. The other thing with the birth vision is that unlike a birth plan, the birth vision is not a concrete thing where if you deviate from it in any way, that the plan gets completely thrown out the window. So in a birth vision, you're still ultimately thinking, I want to have skin to skin. And it's important to me that my baby has skin to skin. It's important that I have that bond. It's important that I feel that oxytocin high. It's important that I am the decision maker. It's important that anything that comes up, any deviation where we might have to change a little bit of the birth plan, that I have my backup plan already in place. And I teach a lot about this as well. And I do actually have a course. So if you ever have any questions about that, you can send me a message at carly@empoweringmomsbirth.ca, and I would be happy to talk to you about that. The next thing I wanted to say is that even as you're creating your birth vision, you also need to be tackling the fears around that. And this is the same with your care provider, because oftentimes the language that our care providers use is going to bring up those fears. It's going to start putting doubts in our head. It's going to be like, well, what if I'm wrong? What if this thing that I want isn't really good for me and they're the expert, and then you're defaulting back to what they want you to do instead of what you want to do. So you need to really get a handle on your fears. And this came up a few times with Jenny and with other clients as well, is that we were really hearing in these appointments, well, my care provider now said this, and now I'm a little bit confused about this. I haven't made any decisions on this, but now I'm starting to have doubts. And I'm like, okay, well, before we take any of that evidence into consideration, go back to your birth vision and start thinking about what it is, your real outcome that you want. And if there is information that you want to learn more about in order to explore this possible option where you might change your mind and do this test or do this exam, then that's something to look at. But it needs to be your choice, and it needs to be one that you have come to the conclusion that, yes, this is right for me. This is what I want. And you can tweak it too. You can be like, I'm coming to my care provider for this service. This is what I want. So that leads into the next one, which is you need to have the mindset that you are the decision maker. You are hiring them. Every single appointment, you are assessing whether they are the right service for you. You are assessing what your needs are before you even go into that appointment. So oftentimes what I do with my clients is it's like, okay, which appointments are coming up? You have an appointment in 4 weeks. Okay. What is going to be discussed at this appointment is probably going to be this. And let's start exploring ahead of time what questions you want to ask your care provider before you agree or decline this intervention or this suggestion, before you even make a decision on something that they have said, before you are even in that office and feeling that fear come up. Let's get a handle on that. So this is a way that you really want to get a handle on those fears, and you want to do that so that you can create your birth vision and stay true to your birth vision, even if something changes in the plan, and to have that mindset in place of, I am the decision maker, I am hiring this person, and this person is here to support and facilitate what I want. They are not here to control me. They are not here to tell me what to do. But there's another part of it, because as I said, there can be resistance. And I've got a lot of tools in my tool belt when it comes to how to deal with resistance. Sometimes what I do is I sit down with my clients and we do a role-playing session. And you can do this with a partner or a loved one or a friend, anyone who's willing to sit with you. And you can do 2 different exercises. One in which you're asking the question, assuming that it's going to be a no. And the other one asking the question and assuming that your care provider is going to say yes. And when you do that and you come at it from both angles, you start to get more confidence, and then you can really apply that so that your appointment goes really well. In fact, this is what happened for Rebecca, is that we did this role-playing exercise, and I didn't tell her which one was going to be the no and which one was going to be the yes. So we did it 4 times. And the first time I was like, okay, you're going to ask the question, assuming that I'm going to say no. And I'm going to say no. And then the next one, you're going to ask the question, assuming I'm going to say no, and I'm going to say yes. And then the next one, you're going to assume that I'm going to say yes, and I'm going to say no. And the next one after that, you're going to assume I'm going to say yes, and I'm going to say yes. So we played around with that a bit. And of course, I didn't tell her which one was going to be which. I just said, okay, this time you're going to assume that this is a yes. And then I would throw a curveball at her. And I did a very good job of basically saying what her care provider wanted, like how her care provider would act based on what she was telling me about the interaction. I'd never met this care provider, but by hearing how she was describing it, I was able to get into that role. So if you want to role play, you want to pick somebody, first of all, who is going to be able to understand where you're coming from and is willing to play with you on that, and is also willing to actually hear what you're saying so that they can actually do some acting. They need to be a little bit of an actor. If they're sitting there and going, this is silly, I don't see how this is going to help, they're not going to be able to support you very well in this. So you want to have somebody who is actually able to sit and do that role play with you. And it's a very helpful exercise. Another one is imagining on your own how you want that appointment to go. Even writing it down can be very helpful. Imagining and writing things down, I have found to be incredibly useful, especially when I'm trying to create anything in my life. In fact, I did this even to get my place that I am in now. I started thinking to myself, I want this home, and this is how it's going to feel when I have this home, and this is how it's going to be and how it's going to look. And I'm going to have seashells in jars, and I'm going to have my pictures up on the walls. I'm going to have my paintings, and I'm going to have a really nice gray sectional couch. And at the time, I did not have a gray sectional couch. That ended up coming to me in September after I'd moved into this place. So you can really do this for any aspect of your life. But the idea is that you're imagining how it wants to go, because people cannot actually do things unless they've imagined it being done first. So the more you imagine your appointment going well, and you imagine how you're going to stand in your power during that appointment, the more likely it is that your brain is going to get tricked and be like, oh, I know what to do now. I know how to handle this scenario. And you can write as many different scenarios as you possibly want on this. And the more you do that, the more you're going to see that you've got this. You've actually got this. Because the bottom line here is that this is your birth, this is your baby, this is your pregnancy, this is your body. You have your own values, you have your own beliefs, you have your own preferences, you have things that are important to you, and they may not be important to your care provider, because for your care provider, this is just another job. This is just another day in their life. At the end of your birth, your care provider is going to wander off and do their own thing and check that off their list of, I got this birth underway and the baby was healthy and the mother was healthy. And it's not going to be as impactful for them as it is for you. However, during appointments, you actually have an opportunity here. And this is another mindset that I want you to understand, is that when I'm working with Jenny and Rebecca and Lisa and everybody else who has come to me over the last 9 years, when I've talked to them, and even for myself as well, it's been about that collaborative energy, because your care provider is not a gatekeeper. They may have been trained to be a gatekeeper and to tell you what the standard of care is and what you need to do, and to pass through the conveyor belt of birth and healthy baby, healthy mother at the end. That's what they've been trained to do. However, they can unlearn that training if their heart is coming from the right place. Now, again, I talked about how there are some care providers who are completely narcissistic. They're just in it for the money, and they're just in it to get the fastest outcome possible. Those are the ones you want to fire. But there are a lot of them who are in it because they actually genuinely want to help. They want to serve. They want you to have a good birth. They just don't know how to make that happen for you because that's not what they've been taught. So in this way, you have the opportunity to teach them something. And Jenny actually mentioned last week when we were talking, she's like, I am basically having him question his entire career by just sitting in his office. And I'm like, yes, you are. And that's a good thing because now you have made an impact on him so that he can then remember you and how you were showing up in your pregnancy and how you were showing up as a client. And then that's going to change how he reacts to other people in the future. And that is how we get that change happening, where we have more supportive care providers. So here's the thing you really need to know, though, is that it's political. There's a political aspect to it. So oftentimes your care provider is not in it just for the money. And they're not in it to make your life miserable or to just be like, healthy baby is all that matters. What they're dealing with is a political aspect of it, in which their hospital or their health authority or the body that they are working under as the obstetricians or the midwives or the college of nurses or whoever your care provider is, they are also operating within their own society. And of course, all societies have different norms and expectations. And our own culture as well has the expectation that you are going to just do what the doctor says. And the doctor has the expectation that the patient is going to just do whatever they say, because that's what they have grown up with. That's what they've been taught. In fact, if you look at how birth is actually taught inside the schools, the way they're doing it is they have a doll. So they have this doll I was just seeing on an Instagram. I believe it was on Spinning Babies, and you can check it out on Spinning Babies. But it was like Virginia, the doll, in multiple different scenarios of emergencies with breech or with twins or the baby's in the wrong position. And of course, Virginia is also on her back, and Virginia is a robot, and Virginia can't exactly express emotions because Virginia, again, is a robot. So the focus, again, is on the care provider pulling the baby out. There is no Virginia on her all fours and pushing the baby out herself because, again, Virginia is a robot. But this is how birth is basically taught. It's very mechanical. So your care provider has gone through a very mechanical system. It would be ideal if midwives were the ones who were teaching doctors about physiological birth and facilitating birth, but we're just not there yet. And honestly, at a home birth, you don't really want a whole bunch of people in the room. That's the whole point of it. So you would need to also be teaching in birth centers, and we just don't have enough birth centers that will be teaching this. I was on a think tank about 9 years ago now, and we even discussed this, that what would our birth center look like? Our birth center would be basically, there would be an aspect of teaching involved where the doctors could come in, but they would be on midwife territory. So the midwives would teach the doctors things like breech birth, physiological birth, any birth in which the baby is sunny side up, anything with any minor complications that can be managed in a home birth, but that a lot of doctors in the hospital panic, such as cord around the neck. That's not even really a complication at all. In fact, I just seen a picture of a baby wrapped up in the cord that had just been born, and this was a home birth. So a lot of these variations of normal are still normal. But because we have such a narrow view of normal in our textbooks from the 1800s and beyond that, especially in the 1950s when Friedman decided that all mothers must dilate 1 centimeter per hour. And just to let you know, because I was just reading about this earlier in Reclaiming Childbirth as a Rite of Passage. Did you know that all of those mothers were drugged up and they had Pitocin? So the whole idea of dilating 1 centimeter per hour is based on Pitocin. And drugs, and these drugs were probably scopolamine and Demerol back then, that puts a whole big perspective, realizing that Friedman's curve is completely wrong. But that's what we're dealing with, is a lot of textbooks, and the obstetric community is still basing those guidelines off of this evidence that isn't really evidence about physiological birth, that's not physiological. So there's that whole catch-22 there, where we need to teach physiological birth, and also physiological birth happens when it's not observed. Anyway, back to what I was discussing, is that your care provider is not familiar with what you're asking for. So when you are declining, for example, the electronic fetal monitoring, especially if you're having a VBAC, that kind of freaks them out, because they are used to having their patients, their clients, on the fetal monitor. Now, the fetal monitor itself, there is absolutely no evidence that this actually is going to provide better outcomes for moms and babies. In fact, it can actually increase your chances of having another C-section or having a first cesarean. So the thing is that a lot of these things that you know are not evidence-based and you know are not going to be good for you in labor, your doctor kind of relies on them. So when you say, I'm not going to have fetal monitoring, they're thinking, well, what if something happens? How will I know that anything is wrong? How will I be able to save you? Well, the fact is that you're going to be in your own body, and you're going to be able to tune into your intuition, and you'll tell them if something doesn't seem right. If baby's suddenly not moving, you're going to tell them. If you suddenly feel a lot of pain at your incision site where you had your first C-section or multiple cesareans, and you say, hey, I think that there's a lot of pain happening here. I think I might be having a uterine rupture, although you'd probably just be screaming. I mean, that in itself is going to detect. You're going to be able to detect things faster than a machine is going to pick it up. And an example of this is that you can have a contraction and know you're having a contraction, and then you're on the fetal monitor, but because the fetal monitor isn't picking up a big one, they're like, oh, that's not a very big contraction. Well, how do they know? You were the one who felt it. But now they've put that fear in your head that that contraction that wasn't really so big is actually going to be much, much worse. And it might not be. You might have a really, really big surge, a big contraction, and not even feel it. Because this is how our bodies really work, is that it can't always be picked up on a machine. The next one, of course, is assessing for progress. If you say, I don't want any vaginal exams. And then they're like, well, how will I assess your progress? They haven't been taught any other way to do it. They don't know that the way to assess progress, which I have actually done as a doula, is to sit back, observe, watch the behavior of the person in labor, and see what sounds they're making. So I could tell at every point of Rebecca's labor whether she was in early labor, whether she was in active labor, at what point her cervix was really opening, at what point she was hitting transition, at what point she was pushing, at what point she was almost done. I could tell just by the sounds she was making. I wasn't physically in the room. There was no way of actually assessing dilation. And honestly, if Rebecca wanted to assess dilation, she could have, but we didn't really care about that. I did ask her husband if he saw a purple line at her butt crack, but that was more because that tells you where dilation is at. I just wanted to see, it's like, do you see a purple line? Okay, cool. So yes, she is dilating. So there you go. There's a visual representation that what is happening is actually progressing labor, because there was a little bit of fear. They'd had 2 prior C-sections, and obviously you want to know if you're progressing. But there's other ways to do it besides just cervical checks. So again, when your care provider is like, well, how am I going to assess you? You say, you know, there are other ways to do that. Would you be open to learning? And the thing is, again, that your care provider, when they are in that fear, it's not your job to suddenly say, oh, well, never mind. I guess I should just do what you say. No, you can still stand in your power. And there's a really simple way to calm yourself down when you're starting to feel that anxiety of, oh no, they aren't on board, they're freaking out. And it's very simple. And I've learned this inside of my virtual coach classes that I've been taking inside of the virtual coach program. You take a nice, deep, deep belly breath. And then you double exhale. And then you do it 3 to 5 times. And then that will regulate your nervous system. And then you'll be able to then focus again on what your birth vision is, what you really want to accomplish in this appointment. Sometimes your care provider might bring things up that you're really not on board with, and you told them that you're not on board. And it's feeling anxious just to have them bringing it up, such as induction, such as a test that you don't want, such as their policies of how they want the VBAC to go. And then you just take your deep breaths. And you remember, what is it that I really came in here for? Oh yes, I want them to sign off on my maternity leave. Or, oh yes, I want them to book this ultrasound for me. Or, oh yes, I just came in here to get the baby's heart rate checked just because I was curious and to monitor my blood pressure. Everything else is their agenda. It's not yours. So you can take that as, that's not mine, and I can gracefully decline again. And I know that I am hiring them for this service, not that service. So I would love to be able to dive deeper into this, because this is a topic that comes up quite a lot. And it's something that I've really figured out while in my own pregnancy, when I was treating every single appointment as a way of collaborating, understanding the system as well. Because remember, I was also the rally coordinator for Improving Birth. So I was picking my midwife's brains, and I was finding out more information, sometimes things that didn't have anything to do with my pregnancy. But I knew when I come in for those appointments what I was really asking for. And this translated to my labor. And the thing about these ways of doing things is that when you know these skills for advocating for yourself and focusing on what you really want, you can then apply it to all areas of your medical care. So even when you have your child and you're bringing them into the doctor for something that you have a concern about, and they start going on and on about how is the baby sleeping and is the baby still breastfed? Oh, well, you probably shouldn't be breastfeeding anymore. They don't really need to be breastfeeding after age 1, which is a lie. Or they start pushing solids, or they start saying other things like you need to have that baby on a schedule. But you really only came in just to see if that colic that you're dealing with, how you can better deal with that. Or maybe your baby has a cold. Or maybe you just came in to see, hey, how's my baby's weight this week? Or you just came in because you had a question on something else. But now your care provider has their agenda. Because again, they usually have a long list of things that they have been prescribed by the health authority and by the policies and procedures within their governing body of things that they have been told, you need to discuss this, you need to discuss this, you need to discuss this, and it may have nothing to do with you. And if you've already decided that you're going to breastfeed, but your care provider doesn't seem to be offering the right advice to you, or you have left your son intact and your care provider doesn't seem to understand how to care for an intact baby, you can choose not to have them take the baby's diaper off and try to retract the foreskin. You can say, no, we're not going to do that. My baby's intact and everything's fine. And if I have any concerns, I will let you know. And then probably find a new care provider if you do have any concerns that come up. Because you don't want someone who doesn't have any knowledge on what you're actually asking for. And the same thing with pediatricians. Oftentimes what I tell my clients is, if you're planning to breastfeed and you go to a pediatrician office and all of their material on breastfeeding is from a formula company, that's a huge red flag. You don't want to go to them for breastfeeding advice. You want to talk to someone who is knowledgeable. And if you do have questions about breastfeeding, Dr. Jack Newman's Guide to Breastfeeding is an excellent book. I have it on Kindle, and it's one of my favorite resources to give clients. Okay, so I've talked about how you can assess your care provider and how you can have that dialogue with them even when you're feeling that resistance. Because the fact is that their resistance has nothing to do with you. It's not actually dangerous, what you're asking for. It's just not what they're used to. So when you take it as, oh, they're just not used to this, they're kind of a little afraid of this, you can come at it not from a combative standpoint, but from a really like, let's find a way to get this doctor to get out of their fear without me having to compromise on what I want. By saying, are you open to this research that I've done? Or I read this article on this. I saw this in the Journal of Obstetricians and Gynecology, or I read it in this article, or let me give you this piece of information, this resource that you may not be aware of. And the ones that are actually open to collaboration and not just on their own agenda will work with you on that. This can even be true for breech birth. In fact, there is a program in which a lot of care providers will be referred to learn how to support a vaginal breech birth by their clients. And this is true for anything, because oftentimes what's being taught in their medical school is just very, very standard. And we know, especially in the midwife community and as doulas, we know that birth has many variations outside of the textbook. So anytime you're going against anything mainstream, anything against the normal standard of care, that doesn't make you wrong, that makes you informed. And then you can then pass that article or that information onto a care provider, see if they're receptive or supportive enough for it. They'll learn, or they'll resist it and say no. But that's okay, because you've taken those deep breaths, you've done the work, you know what you want, and you can stand firm knowing that your choices are your choices and they are okay. And it doesn't matter what their agenda is, because you have your own. Okay, I will see you next week. Talk to you later.